The way that Colorado helps members to receive the long-term home health services they need is changing. Soon, nurse assessors will begin conducting virtual and in-home visits using a new assessment tool. The new tool will better measure a member's needs to have a certified nursing assistant, CNA, or a registered nurse, RN, help them live independently and safely in the community. Rest assured that all of your needs will be carefully considered, and the nurse assessor will ensure they're addressed using the appropriate tools to provide the best support possible. After you watch this video, please know that the nurse assessors will be willing and able to answer many of your questions regarding this change. Overview of the assessment and the LTHH tool. The Long-Term Home Health Tool, or the LTHH tool, was designed to determine the needs of members who require CNA and/or intermittent skilled nursing services in the community setting. The tool, which was determined valid through testing process and gaining consensus amongst clinical providers experienced in assessing LTHH needs, will be completed by a registered nurse in the presence of the member and their family. Moving forward, the registered nurse completing the tool may also be referred to as a nurse assessor. The time needed to complete the tool may vary. However, the LTHH tool was designed to be completed in one visit. The purpose of this new tool is so that all members have an opportunity to have consistency and efficiency in the way that their long-term home health hours are determined. During the assessment, you can have anyone present with you, including family, a friend, a medical provider who is familiar with your care, an advocate, or a case manager. This tool includes questions about basic information, including age, address, health diagnoses, and current services. There are also questions in the tool that will help the nurse assessor understand the support needed from a CNA or a nurse. This support includes things such as hands-on tasks for skilled care needs, such as bathing, eating, range of motion, and respiratory care. The assessment tool factors in how well the member can communicate, including if they can understand what others are saying to them, and how much they can cooperate with hands-on tasks and nursing interventions. Some tasks that will be assessed with the tool are ones that a CNA can help with. As you probably know, we refer to these tasks as activities of daily living, or ADLs. ADLs include many tasks such as bathing, dressing, eating, taking medications, walking, brushing your teeth, and other types of personal care such as going to the bathroom, transferring, and using oxygen. Rating and scoring the assessment. Using the tool, the nurse assessor will indicate how much assistance is needed for each task and intervention to be completed. Because each member's care is so different, the tool allows for a range of abilities to be factored in the holistic assessment. For example, with the task of getting dressed, the nurse assessor can document if the member is able to get dressed with or without assistance, and if the task is age appropriate or not. A 6-month-old infant would not be expected to get dressed on their own due to their age, but a 16-year-old, for instance, should be able to get dressed with minimal assistance. What to expect and how to prepare. To prepare for the visit, please make sure that you are able to share any medical documentation, such as nursing notes from previous services, notes from recent medical appointments or therapy visits, letters from physicians or treating clinicians that describe your needs, notes on how the member can complete activities of daily living with or without assistance, doctor's notes, and school health services documentation, if applicable, with the nurse assessor. Also, please be sure to have your questions ready. The nurse assessors will be happy to help you get your questions answered during the assessment or shortly afterwards.